Hello, and welcome to the PowerPoint presentation for Nursing 321 Professionalism and Professional Values. This PowerPoint is entitled Differentiated Nursing Practice, Different Roles, Better Results. This PowerPoint presentation has been brought to you by Linda Tyler, Lucas Warner, and Tana Weatherford. I am Lucas Warner, and I will be your narrator for this presentation. Differentiated practice prepares nurses to work at different levels within the healthcare field. Some of the entry-level positions for nurses include the diploma nurse, which is a 1 to 3 year program that typically has a more minimal emphasis on the liberal arts, fewer prerequisites, prepares nurses for the technical, hands-on aspect of nursing, but doesn't emphasize so much the theory of nursing practice. Step above that could be considered the associate degree nurse, which is typically a 2-year program and is often done in a community college setting. The advantage that the ADN pathway has is more of an emphasis on the liberal arts and prerequisites that help to make the nurse a more well-rounded healthcare worker. Moving on from the associate degree nurse, the next step is the Bachelor's of Science in Nursing prepared student. This degree usually comes with 4 years altogether, 2 years of which are done studying liberal arts and sciences, with an additional 2 more covering nursing courses, all at the university level. Many hospitals find the BSN prepared nurse more desirable than the ADN prepared nurse due to an increased emphasis on evidence-based practice. Nurses can enter the graduate degree realm of education by going for a Master's of Science in Nursing degree. Typically, this happens after completion of a Bachelor's of Science in Nursing degree and takes an additional 2 years to complete. Upon completion, the Master's prepared nurse has many different areas in which they can work. Some go on to become advanced practice nurses, working in adult health, women's health, psychiatric mental health, pediatrics, family health, or neonatal health. Others may choose to enter the Certified Registered Nurse Anesthetist pathway, where they can provide anesthesia to patients undergoing surgical procedures. Certified Nurse Midwife may appeal to nurses who would like to have an emphasis in women's health. Final option that they may choose is the Clinical Nurse Leader. This is typically undertaken by those who would like to enter the working world in an educational or administrative capacity. Upon completion of an MSN program, some nurses may desire to move on with their education afterwards. One option for doing so could be for the nurse to achieve a Doctorate of Nursing Practice degree. This is a practice-based program that takes 1 to 2 years to complete after the MSN degree. Many believe that some of the nursing specialties, such as CNS, CRNA, nurse practitioner, may one day require the DNP degree, much like many floor nursing is going from the associate level to the more desirable bachelor's level today. For those looking to get into the research, evidence side of nursing healthcare, PhD, a doctoral degree in nursing, can prepare them for that. The PhD focuses more heavily on research, evidence used in planning patient care. The American Association of Colleges for Nursing supports the idea that the BSN prepared student is better prepared than the ADN student. They believe that they are better prepared in critical thinking, case management, health promotion, and in leadership skills due to their increased focus on evidence-based practice. The healthcare environment is rapidly changing. New discoveries and changes to treatments and medications are made every day. The practicing healthcare provider, the nurse, must keep up with these changes in order to provide the best practice to patients. Many licenses require nurses to engage in continuing education to stay current with treatment options. However, it is good on behalf of the nurse to take proactive action to stay current to provide the best possible care. Nursing programs must meet accreditation standards. Currently, there are two major accrediting bodies. The ACEN, which stands for the Accreditation Commission for Education and Nursing, is recognized by the Department of Education and the Council for Higher Education Accreditation. And they are responsible for accrediting all different types of nursing school programs, from BSN to ADN to diploma nurses to doctorate level programs. A second governing body is the Commission on Collegiate Nursing Education, CCNE. They are an extension of the American Association of Colleges of Nursing. They mainly accredit baccalaureate, master's, DNP programs, and post-baccalaureate nurse residencies. Speaking of the American Association of Colleges for Nursing Education, they have identified 9 essentials of baccalaureate education. The first is a liberal education for baccalaureate generalist nursing practice. This equips the student to engage and operate in a diverse and global work environment. The second essential is basic organizational and systems leadership for quality care and patient safety. This tenet prepares the individual for roles and oversight and administration positions. A third essential is scholarship for evidence-based practice. The American Association of Colleges for Nursing Education greatly emphasizes this tenet to reinforce the need to match practice with current research and current trends and changes in healthcare treatment. Fourth essential is information management and application of patient care technology, which brings familiarity with technological advancements used for patient informatics. The next essential is healthcare policy, finance, and regulatory environments, which calls on the student to consider the effects of the economic realities involved in care delivery. Another essential is interprofessional communication and collaboration for improving patient health outcomes. This brings the student to understand the benefit of interdisciplinary approaches to care. It uses all aspects of the healthcare system to treat the patient holistically. The next essential is the clinical prevention and population health. This identifies ways in which health can be improved at a group level as well as an individual one. The eighth is professionalism and professional values, which calls on the student to internalize a respect for professional conduct within the workplace. And the final essential is baccalaureate generalist nursing practice, which prepares the student to interact with patients from all walks of life with varied needs. And this brings us to the end of our presentation with our reference page here at the end. Linda, myself, and Tana hope you learned something about the different roles that nurses can perform within the healthcare system, and we hope that we've inspired you to find your own niche within that environment. Thank you for listening.